USMLE Step 2 CK Oncology Part 2. There is a note. Patient come. She complained, lost weight. Rule out cancer. Note. Acute leukemia, lymphoblast, myeloblast have very premature cell compared to the chronic leukemia. Chronic leukemia have almost mature cell. Lymphoblast leukemia is mostly B and T cell dominated. Myeloblast have erythrocyte, granulocyte, monocyte, megakaryocyte, B and T cell progenitor. Acute myelocytic leukemia MP3 or acute promyelocyte leukemia patient could have disseminated intravascular coagulation due to cause the injury to the blood vessel. Acute promyelocyte leukemia patient could have hypergranular promyelocyte and each cell has UR rod RODS or rod. Tumor lysis syndrome. Patient with acute myelocyte leukemia or acute myelocyte leukemia patient is on chemotherapy. Both cause massive lysis of the tumor cell, and patient has hyperuricemia. Give plenty of fluid and diuretic. Because of hyperuricemia, diuretic mannitol. Give mannitol intravenously. Alkalize the urine by giving sodium bicarbonate. Also give the allopurinol to prevent the formation of the uric acid. Lysis of the cell also release the potassium in the blood and cause the hyperkalemia, and patient could develop cardiac arrhythmia. Give this patient IV calcium, insulin, dextrose to prevent the potassium to develop arrhythmia. Severe case may need hemodialysis. Number 3. Lysis of the cell also release the intracellular phosphate. Phosphate would react with the serum calcium, and serum calcium concentration will go down. Patient would develop severe hyperkalemia effect. For example, patient have arrhythmia, patient can develop tetany and kidney failure by the precipitation of the calcium and phosphate in the kidney. And hyperkalemia cause arrhythmia, low calcium cause tetany, and calcium and phosphate will precipitate and that cause damage of the kidney. And give this guy calcium, plenty of fluid and diuretic to prevent the arrhythmia from the hyperkalemia, and also hyperuricemia. When hyperuricemia, give fluid and diuretic. Fully differentiated tumor like acute leukocyte leukemia, acute myelocyte leukemia, Burkitt lymphoma has rapid cell turnover. They grow very fast. When you give the chemotherapy, tumor rapidly break down and cause the tumor lysis syndrome, and cancer cell itself can cause the tumor lysis syndrome. Due to the rapid breakdown of the cell, patient could develop acute urate nephropathy, and that can cause the damage to the kidney. Hyperuricemia cause the acute urate nephropathy, and when kidney damage happens due to the stone, PUN and creatinine will be increased. This is diagnosis. Effect of the cell breakdown which increase uric acid and injure the kidney by a stone. Serum uric acid increase, hyperuricemia. How it happened? Due to the degradation of the cell protein can cause the hyperuricemia, which cause the kidney failure. Serum electrolyte, intercellular iron, potassium and phosphate increase, calcium decrease due to the phosphate react with the calcium. EKG, arrhythmia develop, and prolonged QT interval due to the hyperkalemia. So tumor lysis syndrome treatment: give fluid, insulin and diuretic. Give allopurinol to relieve the acute urate nephropathy and renal failure. Treat the hyperkalemia to prevent the sudden death and arrhythmia. Arrhythmia is very emergent to treat it, or patient could have died due to arrhythmia. Trauma patient lost blood and release pack of red blood cell. What's going to be happen if you give pack red blood cell? Receive pack red blood cell, patient could develop the hypocalcemia. How? Pack red blood cell was mixed with citrate anticoagulant. It works as a chelation agent. After infusion of the citrate, it will chelate the serum calcium, and patient develop hypocalcemia. Serum calcium, magnesium bind with the citrate, and when serum calcium and magnesium go down, patient could develop the paresthesia, such as patient complained of the tingling sensation at the finger. To develop the paresthesia, patient need to transfuse 1 pack red blood cell in 24 hours. So give blood slowly. Pack red blood cell could lose the intercellular potassium, and after give the pack red blood cell, patient can develop hyperkalemia. Leukemoid reaction. What is Leukemoid reaction? Infection or inflammation, increased leukocyte, markedly increased granulocyte precursors such as neutrophil. So band, which is also called left shift. Serum leukocyte alkaline phosphatase, which will increase. So new neutrophil will increase. Neutrophil increase significantly. and could be greater in number than segmented neutrophil. Lymphocyte would decrease. Promyelocyte, myelocyte, metamyelocyte also be seen in the serum. Hemoglobin, hematocrit normal, white blood cell count significantly increase. So now in chronic myeloid leukemia, also increase the granulocyte, but leukocyte alkaline phosphatase is low. Note, leukocyte alkaline phosphatase may also increase when patient has polycythemia vera due to clonal myeloproliferative disease. Hypoxia does not increase the leukocyte alkaline phosphatase, which only increase the red blood cell. But clonal myeloproliferation can cause the polycythemia and increase the neutrophil. All cell will be increase. So now complication about leucostasis. Leucostasis reaction caused by both acute leukocyte leukemia, acute myelocyte leukemia. When a massive amount of the immature white blood cell in the blood vessel, it causes the sludging with the white blood cell in the blood vessel. Prevent blood circulation. Patient could have headache, confusion, dyspnea, brain hemorrhage, blurred vision, priapism. Patient has high number of neutrophil and or lymphocyte in the serum. Treatment: after established diagnosis and patient has symptom due to increase the significant amount of the white blood cell, do the leukophoresis as an initial management. Separate this. Take this blood, separate this, and put the normal thing inside the cell. Take care of the sludging. If patient has high number of white blood cell but no symptom, can give hydroxyurea to decrease the cell count. Symptom, do leukophoresis. No symptom, give hydroxyurea. And definitely chemotherapy.